Springfield School Board tonight expected to take up a resolution to send to the Illinois State Board of Education saying that the COVID-19 vaccine, if approved for children by health officials, that it should be added to the list of other vaccines that children have to get in order to attend public school. Your reaction, 217-629-7970. That's the phone number here, live and local on the WMAY Morning News Feed. I'm Greg Bishop. If you need to get a hold of me, it's pretty simple. You can email me, bishoponair@gmail.com. You can also find me on Twitter, Facebook, Instagram, and the like. And again, WMAY.com, where you can find podcasts and social media links and the like. So what do you think? 217-629-7970. That's the phone number here for the WMAY Morning News Feed. So we do have mandates in place for educators to get the COVID-19 vaccine or to submit to weekly tests. And we could very well see this play out in the courts, where some people may take issue with the mandate because it's not been spelled out clearly in law that COVID-19 vaccine should be mandated. So educators facing possible suspension or administrative leave across the state, and even in healthcare settings as well, some healthcare workers facing administrative leave if they don't comply with regular testing. So that's another issue altogether. But what we're talking about here is, should the COVID-19 vaccine for children, if it's approved by federal regulators, should it be something added to the list of vaccine requirements for kids to attend public school? I want to hear from you, 217-629-7970. And again, you can sound off on this as well by going to WMAY's Facebook page and watch the live video here and sound off on the poll there. Again, 217-629-7970 is the phone number. A lot of different vaccine mandates being implemented at United Airlines, for instance. We've heard about that, but also JetBlue, Alaska Airlines, and I believe American Airlines now announcing that they're going to have vaccine mandates. But that's for employees of a jetliner. Right? We're talking here about your children. And is it something that your kids should be required to get in order to go to school? It's not something that's been approved yet by the FDA or the CDC, though those efforts are underway to allow for children under the age of 12 to get the COVID-19 vaccine. Right now, I think it's 16 and up can get it, I believe, or I can't remember which age threshold that is, but not all kids are eligible to get the COVID-19 vaccine. But the Springfield School Board could take up the issue tonight at their board meeting, and I'm curious to hear from some of the parents out there. Even if you're not a parent of a District 186 students and you're a parent of, a kid in Decatur or a kid in Auburn or a kid in Williamsville or wherever it may be, I want to hear from you. Is this something that you think is necessary? Or are you opposed to this, or are you not sure? So 217-629-7970 is the phone number. Good morning. You're on WMAY.
Good morning. A couple of questions. So who's pushing this? Is it the school board or the teachers union at District 186? Who's driving this?
Well, it's an initiative that was brought forward by a school board member. So we'll hear their arguments for it, of course. But obviously, you're going to have parents who are going to want to sound off as well at tonight's school board meeting.
So wouldn't they have to produce some sort of, I hate this term anymore, but scientific evidence that there is proof that children under the age of 16 or whatever are spreading this and causing issues? Because I know in our school district, where my kids go to school, we haven't had an email or a notification of a positive case or a positive student or staff member. I bet it's been almost 2 months since we've seen anything.
Well, and I'll tell you, even in Hillsborough School District, where they haven't been allowed to enforce mask mandates on kids because of a court order, they've actually seen their COVID-19 positivity decrease.
Correct. Probably because these kids aren't touching their faces 8 hours a day with a mask on, and their dirty hands aren't all over their face. So that would be one of the reasons, probably, because of that happening, and even natural immunity. And kids also react to this way different. So that's why I feel like if the adults are pushing this, either school board or teacher, there's no evidence that they're a problem,
Your phone's breaking up a little bit, but I think we got your initial point is you want to see the evidence that this is something that is necessary for kids, because I mean the evidence has been that children do they get COVID-19, but they don't have it as severe as maybe some older adults may. But we do have older adults in schools. They're required to have the vaccine. So, is that layer of protection that is enough, or is it something that you support to require kids get the COVID-19 vaccine before they're allowed to go to school? Good morning. You're on WMAY.
Hey, Bishop.
Hey.
Hey. Listen, there's zero trial with this because there's not kids that are taking the vaccine, and there's no way to know. I've heard people use the analogies. Well, people get vaccine for the measles and mumps and rubella, blah blah blah, but those have been tried and true over decades. This is a vaccine that was thrown together pretty quickly. And there was some huge sample sizes, and it's been moderately effective with adults. There's no way my kid's going to get that. I'll just homeschool them if that's what it's going to come to. I think that school boards like 186 and others need to. I think that they do have. The best interests of the kids in mind, but I also think that they need to look back and understand that they work for us, and at the end of the day, this is not a medical. This is not a vaccine that has been tried and true. We don't have decades of data on this. We have zero data with kids under 16. So
well, and with that too, you've got the variants, and there's ongoing questions about the vaccine's effectiveness on the various variants, and what about new variants that haven't come out yet? And it's something that I think some people still have reservations about, even those who support vaccination. But ultimately, you're saying you would take your kids out of school if this is something that's mandated in public schools.
Yeah, I'm vaccinated. I'm an adult. Okay, I'm vaccinated and I worked in the medical field, and but my child, no, I will pull my kid out of school and they'll be homeschooled. End of story.
Public schools. Yeah, appreciate the call on that. 217-629-7970. Take your calls on whether you think that COVID-19 vaccine should be required for kids to go to public school. Now, the resolution tonight with the Springfield School Board is not going to require that. It's just a resolution. It's a resolution they want to send to the Illinois State Board of Education to show support for this, and to say if this is something that the FDA or the CDC or health officials ultimately approve, then they would like to see it listed as one of the vaccines that are required for kids to go to school. What do you think? 217-629-7970 is the phone number. It is the WMAY morning news feed. You can also email bishoponair@gmail.com, or you can take the poll on the live Facebook video as well. Just click on the little signal up there. It shows a little graph, and you can take the poll there. But I want to hear from you. 217-629-7970. You had California Governor Gavin Newsom last week essentially say, yes, this is going to be a mandate for all kids to go to school. They have to get the COVID-19 vaccine if it's indeed approved by federal regulators for children. You have others, Jim Justice, Governor, what state is he in? Let me pull that story up really quick. But ultimately saying that they are not going to have COVID-19 vaccine be required, and that's West Virginia's Governor Jim Justice. So you see different states taking different tacks here. Even if it's approved for kids under a certain age, California says, yeah, we're going to make it mandated, and West Virginia is saying, no, that's not something we're considering. What say you? Good morning, you're on WMAY.
Good morning. Yes, I absolutely agree with it being mandated. It was not a rush vaccine. Obviously, I'm a nurse, so they've been working on a SARS vaccine, which COVID is a variation of the SARS virus, since 2002. That's when we had our first SARS outbreak in the medical, profession. And then there's been all these variants. So it's not a new vaccine. It just got, authorized early. But I just want to educate people that it was not a rush vaccine. They've been working on a SARS vaccine since 2002.
Well, and the platform underneath of it, the mRNA from Moderna and Pfizer, they've been working on that technology for decades.
Correct. And what else people need to know about mRNA is that is actually a variation that they are currently using to try to come up with a vaccine for cancer. So, people need to think, well, if it was an mRNA vaccine and it cured cancer, would I take it? Or maybe all of us who got the COVID vaccine, maybe there's some little bit that maybe.
Well, let's not start, speculating maybes, this, that, and the other. I understand.
No, I know, but that would be great.
But,
so I totally agree with the mandate.
Yeah, but do you think that that's something, of course, we have to wait for federal regulators, but is that something that we should codify? We're seeing right now in the courts the question about the Healthcare Right of Conscience Act, and now we've got this idea that Thomas DeVore brought forward in court about the Illinois influenza vaccine law and how that's specifically carved out to allow for flu vaccine to be required for certain settings, like healthcare settings.
Correct. We've been mandated to do that for the last 5 years. Totally okay with it. I don't want to give it to my patients as well.
Well, but
that's the other part.
But legislators, your elected representatives, passed something into law to allow for that, right? Should they, if the FDA goes through with this and approves the COVID vaccine for children, should lawmakers spell that out in law, go on the books, go on paper as supporting one way or the other on this?
Yes, because like I said, the other vaccines are mandated, and they have been for centuries. And imagine if those vaccines that are mandated for kids well, but I'm saying I agree with it because that's how you get through a pandemic, and this is how we move forward. But how we learn about diseases.
But again, with the pandemic, who's most impacted by this?
Well, but I think everyone's impacted by this.
Well, we're impacted by it on levels that, you got government's reaction to it. Yeah, everybody's been impacted by that and the economic impacts of it, the government shutdowns and whatnot.
I'm talking about emotional and just life adjustment of everybody.
No, I get it.
Whether,
I get that, absolutely. But whose physical health is most impacted by the pandemic? It's older people with underlying conditions, right? It's not younger kids. I get that, absolutely.
That I'm not sure of. I don't know if it's life or death for younger kids, but right now it's not older people. I will tell you that.
I think the data shows that. The data shows younger people are less susceptible to severe COVID disease than those who are older with various underlying conditions, from obesity to diabetes to, heart conditions and so on. So
but how you don't have it get to everyone, and it's not just older people at the moment. It was at the beginning when it first started. Now it's people in their 30s, 40s, and 50s. Just so you know.
Again, with underlying conditions.
Not always.
Do you have all the data to prove that?
No, I do not.
Right, but that's something we need to make better informed decisions. Is all of the proper context. I appreciate the call on that. Let's take another good morning. Should the school board go ahead and approve a resolution to send to the Illinois State Board of Education saying that if it's approved for kids under a certain age, it should be required to go to school? Good morning.
Well, I don't know yet. I don't know that the data supports that. They are not the highest risk group, number one. Number two, does anybody get a vaccine after they've had the measles or chicken pox? No, you're not really required to. But people need to start looking at the vaccine reporting system that healthcare providers are required by law about adverse reactions. It's available through CDC and HHS. I'm not an anti-vax person by any stretch, but there are significant numbers of adverse reactions. And if there's adverse reactions reporting with younger people, better take a closer look at mandatory for particularly younger kids. Well, they're not the highest risk group. So
we've seen some data already suggesting that under the age of 30, those who get the COVID-19 vaccine might have an increased chance of of heart inflammation. And we're seeing that data, and that we saw that months ago. It's still the case. I mean, it's something that they do consider, and it's something that they're also, working into the equation as to whether or not this should be allowed for children under a certain age. So we have yet to get to that point of approval for this certain age, but we see that the school board in Springfield is already willing to send a resolution to the Illinois State Board of Education saying if it's approved, we should make it required for all kids to go to public school. So you're saying that's something they just need to hold off on.
Well, they need to look at the data a little bit closer. What is the longitudinal study of adverse reactions to a certain population underneath a certain age? They don't have that data. So why would they make this massive leaps right now, mandating children to get this? It's an influenza type disease. Follow the path of Spanish flu, went through three phases, and then it did eventually mutate, and who knows? Maybe it's just a common cold now. I don't know, but you get way too much politics involved in this.
Appreciate the call. Something we'll see if they do indeed bring it up for a vote tonight at the Springfield District 186 School Board, and what the parents have to say. Something else I'm also interested to see is, will those public comments from parents be allowed on YouTube? Because YouTube last week announced that they're not allowing what they did consider vaccine misinformation on their platform, and whether or not that's going to impact Springfield District 186's YouTube channel, as it has already in one video back from June 21st being removed. But after I questioned YouTube about it, they went ahead and put the video back up saying, hey, it's okay. It falls into some of their exemptions for the policy. So we'll see if those public comments from parents are allowed on the platform after tonight. So take one more call here on the WMAY morning news feed. Good morning. What do you think? Should the school board move forward with this idea to send a resolution to the State Board of Education saying, hey, if COVID-19 vaccines approved for kids, it should be a requirement?
No, Bishop, I just got over it. And I had one day, and I've been taking a lot of supplements, and it wasn't bad at all. And I'm about 60 pounds overweight. But I don't think they should force it. I think it ought to be a choice.
Well, and think about this, too. If you just got over COVID-19, depending on the severity, your natural antibodies to it are going to be much more effective than what the vaccine's able to offer up, at least according to the most recent research we've seen.
Well, my doctor told me if you get a vaccine, wait 90 days, because if you do get it before 90 days, he says you could have health problems because of what you just said.
Interesting. So, again, that's your doctor telling you that after you just came through battling COVID-19. Hey, I appreciate
it. And my wife had it, too.
Wow. Well, thankfully you're here and you're calling in, and you're able to take part in today's show. Appreciate that. Be safe.
Okay, thanks, Bishop.
Absolutely. It is the WMAY morning news feed. Got to take a break. 628 from Culver's West on Wabash. Your forecast, the high of 74 with the possibility of some showers tonight.